I found that masculinity in itself plays a key role in the way that we even view healthcare. So, let alone going to a hospital for regular care, we don't keep up with our regular appointments. We know a lot of Black men tend to use the emergency room 43%, according to the literature, as opposed to keeping scheduled appointments, let alone following up. That's not something that we've seen a lot of people dive into prior to, I would say, this generation. This generation is more woke, so to speak, in terms of the importance of emotional intelligence, the importance of boundaries, the importance of making sure that we are in good mental health spaces.
Good morning. Today is February 26th. I have the pleasure of interviewing Dr. Harrell Jordan, a doctor in nursing, PhD, Christian counselor, and career coach, dedicating to motivating people, especially Black men, to overcome challenges and embrace healthier mental spaces. How you doing today, Doc?
I'm doing well. How about yourself?
I'm doing really well. It's a pleasure to talk with you. It was a great conversation I had with you on the phone, and I love the space that you are working in.
I'm just happy to be here with you and having the ability to share some of the things that I've learned along the way and hopefully inspire others.
So I'll just jump right into it. Why did you choose to become a nurse?
Well, that wasn't my initial dream. I initially thought that I wanted to become a pediatrician, but with some trials that I had, mostly in terms of getting into medical school, it was given to me that I should possibly consider other routes. And when I say given to me, the Lord told me, hey, that's not it. So I decided to look into ways in which I can use the degree I already had and the studying that I'd already done. Since I was pre med, I had a lot of science background. I thought I wanted to become a nurse practitioner. So I went into the master's entry to nursing practice program at DePaul University. During that program is when I found out two things. One, that I did not like pediatrics like I thought I did. So once I got to pediatrics and nursing, that wasn't for me. I am a 6'3", almost 300-pound guy dealing with a neonate. Mm, maybe not. But I also found my passion for teaching. So I became a graduate assistant and had the opportunity to help in health assessment labs, and being able to meet students where they were, even still being in the program, and explaining the material in a way where it made sense to them really sparked a bug for teaching for me. And then there was an opportunity to do a bridge to PhD program where during that info session, the individual looked directly at me and pointed and said, "We need more of you in academia." And that launched me into pursuing my PhD in nursing in connection with the University of Illinois at Chicago.
How does it feel to be, using your words, a person that looks like you in the nursing field?
Well, I've had to become comfortable in spaces where a lot of the faces don't look like mine. And it's not a bad thing. One, we all know that nursing is a predominantly female field. However, it's not exclusive to females. I think because of the way that society has branded nursing, it may discourage others from even pursuing this as a viable option. And we just don't know. We're not educated enough to understand the different levels of nursing that exist, let alone the different avenues you can go into just in having your nursing degree. Is more than just working at the bedside. We are needed in academia. We're needed at leadership tables. We're needed all over. We're needed in research. And coming into this field, I was the only African American male in my cohort for nursing, one of 60 that were in the class. Going into my doctorate degree in nursing, I was the only Black male, and I graduated as the first Black male from my college's School of Nursing with a PhD. I got comfortable being the only one because I brought a fresh perspective. I brought something that others may not have thought of before, but it was respected in those spaces. And in doing so, it allowed me to create a lane for myself. And it also it gave me what I needed in order to be able to give back to others behind me to show them that this is possible.
So you said you're a 6'3", almost 300-pound man. How did that actually play into being a nurse? And like, were you used as the workhorse?
Great question. So when I first became a nurse, I've only been a nurse in the emergency room at one particular hospital on the west side of Chicago near Oak Park. And in being in the emergency room, often, even from the patient lens, I got two things. One, they often called me Tyler Perry because they said I looked like him. But in addition to that, I would walk into rooms and they would assume I was security. They'd think I was a security guard, despite the fact that I had a badge that said nurse. Or I've been in places where the patient has told me, hey, the next time I come back here, I want you to be the doctor. I don't want to be an MD. I'm fine being an RN. There's nothing wrong with that. And in fact, I've grown passionate about the bedside manner that RNs carry and the way that we can connect with the patient in a different way than being an MD. But I wasn't necessarily used as a workhorse, but surely if they needed help lifting a patient, yep, we're going to have Harrell come and help us do that. Now, I wasn't the only male on the unit. A lot of males who are interested in nursing go into ER or ICU in particular. So there were other males, but I was definitely the only black male.
What made you decide to go into ER?
So for me, I am fast paced and I like critically thinking. So I'm not good where I have to do the same routine over and over and over again, or even seeing the same patient for days on end. I'm very good when you come in for a problem that I can fix and we get you on your way. So my motto was get in, get out, and get on with your life. And the motto of emergency rooms overall is stabilize and dispo, meaning once we get you what you need, we're either sending you home, we're sending you to a different hospital, or we're sending you to one of the units at our hospital. That fits my personality. You have to have a certain personality to work on certain units. So in the emergency room, quick, fast pace, and I have to be comfortable with being able to let go of a patient when it's time for them to go. Not everyone can do that. Some want to build that camaraderie and build that relationship over the course of days. That's not my makeup. I want to do things quick and efficient and get you where you need to be.
So talking about efficient, need to be, how is it being an ER nurse and seeing the men struggle when they come in mentally?
Well, being an ER nurse, you see a lot of things. So I see OB patients, I see pediatric patients, I see geriatric patients, adults, as well as mental health, as well as addiction. So when those individuals come in, especially the black men, I had the opportunity to meet them at a different place, meeting them from a lane of experience. Because even if they didn't come in for mental health issues such as depression or suicidal ideation or schizophrenia, many patients have some underlying mental health thing that comes about during this time of crisis. So, for example, the very first African American male patient I got that really led my charge in my dissertation was a young black man, about 25 years old, who came to the emergency room after passing out upstairs visiting his mom in the ICU. So they sent him down to be evaluated. I was his triage nurse, and I was able to ask him some questions to figure out, hey, did you pass out due to what you saw, or was it under the weight of the experience overall? Or are there health issues that we need to be considering? And I was able to check his blood pressure, get his weight, and all of those things. And there were a number of health issues that he had, in addition to some mental health things that we could dive more into. The biggest one is one, valuing healthcare, and two, making sure that we even believe that we can be different. If you don't have the belief that you can become something different, you're stuck where you are. And we had a conversation to try to get him to a healthier place.
So what is your perspective on a black male seeing you in there instead of seeing a white male when they start talking about mental health?
Historically, the black community has not had a good relationship with healthcare just based on things that have occurred in our past or experiences they've heard from other family members. And as such, my research shows, there's other research besides mine that shows that cultural congruence with the provider, whether that's me doing research or the individual they're experiencing when they come into the hospital, makes for a increase in trust, an increase in value, and an increase in likelihood for them to actually listen to the things that you're saying. relatability is key, and that goes for everyone. But having the checkered past that we've had with healthcare, it's important to feel like the healthcare provider understands where we're coming from and has our best interest to advocate on our behalf.
See that in education, you see that in child development. When they have a person that looks like the person that's interacting with them, they have more buy-in
Mhm.
to actually being able to help. While you were in school and being, you said, one of 60, how being uncomfortable in comfortable spots, how did the professors make you more comfortable, or did you just have to figure it out?
I wouldn't say that my professors really put emphasis in making me feel comfortable. I just had to figure it out. So, in those spaces, you have to find the individuals that will connect with you. So, just because there weren't any other Black men in the program, let alone there were no Black males who were actually in the academic portion, there weren't any teaching me in the nursing program. I had to find my own group of people who could relate to me on some other level. And I did. Obviously, most of them were women. However, relatability is key because you can't do many things alone. Being alone in a silo would have made my nursing experience or even my nursing school experience extremely difficult. That program in itself was an accelerated program. So, and it was a master's level program. So, in addition to the nursing courses, I had to take master level courses as well and do a research project. And we were able to do all of that in less than 2 years. It was intense. And there were things that I had to do for my own personal life to make sure that it lined up appropriately. But I also had to make sure that I had friends who were maybe better in certain areas than I was to hold me accountable or to challenge me. I had to have friends who were on top of their work and on top of that calendar so that if I might have forgotten something, they could tell me, or vice versa. I could help them and remind them along the way so that we all made it out.
Now I'm in an accelerated program for my master's in social work, and I'm the only one that looks like me in the whole group.
Hmm.
And it's just a very interesting relationship and trying to build relationships and hearing about actually, this is one of the things I thought was really interesting. I discussed this with you is that for my diversity and racism class, it's about, and maybe you could speak on this, about the outcomes of African or Black women or birthing people that have had a disproportionate rates of higher um, deaths from it, the drug toxins that goes to them compared to the white counterparts. And do you know much about this subject or
While I haven't done a deep dive into the literature in this subject, I am familiar with this topic. I'm aware that, especially in healthcare, pain is not rated the same for Black women versus other women. And that's likely because my wife, who's also a nurse, did a research paper on that during her own master's program. And she's a Black woman. So I can experience that alongside of her. Being that many medical fields may not have a number of individuals that look like us, the relatability isn't there, and there could be a dismissive nature in terms of pain that's being expressed or concerns that are being expressed that leave gaps in care that may not be experienced by other individuals. So it's our job as healthcare professionals and even within the profession that you're going into to make sure that we take every complaint seriously and we don't dismiss it or brush it off as if it's something that's not real.
I agree with that. It's the language that I've read in my research, it's they treat women of certain color to be more hostile and when they're actually being assertive and it's not actually the right way. It's a person that's communicating the way that they can. And so this will actually transfer into another area. Why what do you think has really stunted the ability for the Black man to be able to start talking about mental health? And what do you see as some of the possible solutions or moving the needle in the right way?
Similar to what you just mentioned, there are some societal norms that we have to overcome. So, just to put a bow on the previous topic and then transition to Black men specifically, One, we have to be aware of what's going on. And two, we have to be advocates for ourselves. With our past as African Americans, we've had to fight to make sure that our voices are heard over and over again. And in doing so, the passion that may come out from that fight is deemed negative when in actuality it's just us advocating for ourselves. So we have to make sure that we protect our Black women and make sure that we are also protecting the clarity of what a person is expressing is necessary. No matter what that individual looks like, it may come off different as you go from culture to culture. Those are the cultural differences. But if we're more aware of cultural differences, we should also be more aware of the fact that just because this tone seems different from this person versus that person, I still need to take this seriously and figure out a way to connect differently. With regard to Black men or men in particular, when it comes to mental health, there is a stigma with regard to pursuing help overall for men, whether that's health care or even help from others. There's a belief that men should be able to handle it all. Help often is looked at, based on the literature, as a sign of weakness. So instead of me asking for help or me getting answers from someone else, being looked at as me being educated or me being an advocate for myself or helping myself get to the next level, instead it's looked at as though I should have known that on my own. It's a bruise to the ego, bruise to the pride. And that is not the case. Those are things that are embedded in our or in the way that we express masculinity. And I found that masculinity in itself plays a key role in the way that we even view healthcare. So, let alone going to a hospital for regular care, we don't keep up with our regular appointments. We know a lot of Black men tend to use the emergency room, 43%, according to the literature, as opposed to keeping scheduled appointments, let alone following up. To that point, if that's regular healthcare, mental health, that's not something that we've seen a lot of people dive into prior to, I would say, this generation. This generation is more woke, so to speak, in terms of the importance of emotional intelligence, the importance of boundaries, the importance of making sure that we are in good mental health spaces and they don't shy away from counseling experiences. While prior, we in the Black culture may have been taught to keep things in house, keep things to ourselves, give it to God, and that healing may not have occurred as rapidly as it could have if we just gave voice to the problem.
What would be the buy-in that you would actually tell a person or share with a person about how mental health can either help them or help their family or other relationships?
We need more people doing or participating in mental health endeavors. We have to diminish the stigma that's already associated with mental health. Right now, if a Black individual were to say, yes, I go to a counselor, it's fine. 10, 20 years ago, if a Black individual were to say, yes, I'm seeking counseling, it would be, what's wrong with you? Are you crazy? Why do you have to go to the brain doctor? What's going on? You're crazy. Those labels in itself deter people from pursuing mental health endeavors. It's our job to give voice to the fact that some of us are actually going to see counselors and we may not be saying anything. Because we're not saying anything, we don't know how common it actually is. We, the individuals that are seeking mental health services or are providing mental health services, have to make sure that we are diminishing the stigmas and providing safe spaces so that individuals can explore other opportunities to help themselves heal.
What do you think about the barriers of even knowing how to use therapy in a toolbox?
Well, to your point, one, if individuals are not pursuing healthcare overall, I don't know how they would necessarily begin to look up mental health services. For Black individuals in particular, my belief is we have to change the way that we value healthcare. Not saying that we need to value it as is, but right now we don't see the benefits of it in the way that we potentially could. So, as such, it's important for people like myself. I didn't necessarily go to school for mental health in particular, but I've always known that my community, especially Black men, need some individuals just to talk to. Counseling is talking through issues, counseling is reframing perspectives. And using platforms like this one, using social media outlets, using individuals that look like me to be the voice behind mental health services are key so that we can give individuals the idea that this is something they may want to consider. It is a conversation, it is a judgment free zone, and it's affordable. I think that's also a piece that comes into play when it comes to healthcare. Whether or not someone has insurance, is this going to be covered? How much of this do I have to pay for out of pocket before insurance actually does their part? Is that something that I want to pursue, let alone flexible schedules? Because we work. So if you work a 9 to 5, where are the counseling services that are available after hours? That's why I wanted to kind of stand in the gap for my people in particular. I'm open to all, but as I'm a Black male, I know that other Black men need to see me. So I offer counseling services as being a certified Christian counselor that are a lot of times after hours. So 6, 7, 8. My latest one is 9 p.m. I can't really do after that. I need to go to bed myself. But I also don't require insurance. It's not free. It's $50 an hour, $50 a session. But that's comparable to a lot of the copays individuals are paying even with insurance. Making sure that there are resources available is very key because a lot of times, although we think it's available and we think it's affordable, it may not be.
$50 to some people is a lot of money, and it still is a lot of money. The reason I was asking that question, and I'll phrase it up just a little bit differently, is that I have seen with people, they don't realize the return on investment or the compound and interest that they would gain by mental health and how it's able to change a person's narrative and also change the relationships, and it decreases the fights. And I've seen that with people that served in the Marine Corps, like myself, that even get free healthcare, or not all get free healthcare, but the free mental health when they actually come back with PTSD, that they don't realize the value of actually the change. And as being a Christian counselor, using more of a faith-based, how what kind of changes have you seen while you've been doing the therapy? And then also some of the not really sharing the person, but some of the conflicts that they have actually started to oppose of the healing process.
Sure. In being a Christian counselor, one, just going back to my reason for doing so, being a man of faith myself, I have experienced many individuals who are also people of faith who have the quote, just give it to God. Give it to God, give it to Him. He can heal it all. I 100% agree with that. I would also say if you don't even know what you need healing from, you don't know what you're giving to God. You're not giving Him the root of the issue. And counseling is a space to talk through your current issue, but also pinpoint where this issue actually originated. Because if you don't pull things up from the root, it'll continue to come back like a weed, right?
Mhm.
So incorporating those Christian aspects is a way for it to create a safer space for faith based individuals to pursue counseling. Anything that I say in my sessions not only stay confidential, but I always push people back to the Bible and push people back to God. I have to be Holy Spirit filled myself to even know how to navigate through those spaces because sometimes individuals that I've counseled are going through things that are spiritual warfare, meaning they are going through things that require a deeper connection with God in order to pull themselves out. Because the problem is likely more complicated than people realize. And the problem in some cases I've dealt with are more convoluted and it's more gray. And it's our job to create a clearer path. And to get a clearer path may mean digging deeper into scripture, digging deeper into your prayer life, digging deeper into the connection with God, having that daily devotional, and even the way that we pray. So having an understanding of God isn't a genie who just grants things because you ask for them. Sometimes you are going through a tough time and you need to figure out if there's purpose behind this. Or Is this something you could have avoided if you had just listened to what he said in the first place? So some of my sessions with individuals have included things like creating a devotional schedule for them. Hey, you may not be praying to God every single day at this point. Let's try the moment you wake up, give God 5 minutes. Or a lot of times, and I'll be candid in saying a lot of the males that I counsel meet me in their cars. And what I mean by that is I'm in my office on my computer. They choose to take their counseling session from the car. One, for privacy. Two, because they're trying to do things on the go, yet still trying to prioritize their mental health. And I have to be open to that. Although I don't like them driving. Go sit in the parking lot. Like we can't do this all at one time. But I want to meet people where they are so that they actually prioritize their mental space so they can become the people that they need to be for their households, whether single, married, parents, what have you. It's necessary to show up as your best self.
It's how do you find God to be I guess to say the meld or the intertwine in a person's life to keep them healthy?
Absolutely. So, as a Christian counselor, that means my own life is led by God. So, whether or not I tell you the thing that I'm giving you came from God or not, it is, right? So, a lot of the things that I'm giving aren't necessarily things that I got from the counseling training that I received. Some of these things are on the fly, and I know that it's landing well with the other person on the other side because they'll start to get emotional or they'll say, "How did you know?" I didn't know. It's been given to me in this session. That's how I know that what I'm doing is necessary, and some things can't be trained. At the end of the day, I need to meet people where they are. And in order to do that, there's going to be some things that they may not even be able to articulate on their own, but I have to be able to get in there and help them to figure it out and give them a different perspective to reframe it. If I don't do that, I'm not doing God justice. I'm not doing our session any justice, but it's necessary. He is intertwined in everything that I do in those sessions. It's not just off of the strength of Harrell because I can't do it because it's also heavy. Taking on other people's issues isn't something that you step into lightly. Yes, I'm a nurse. Yes, I'm passionate about mental health. But some of the things that my individuals go through, it's deep. It is hurtful. It's painful. So I even have to guard myself to make sure I don't carry the weight of what they're going through into my own household. So God is intertwined in all of it, and they also have that understanding. I'm also not the type of counselor that doesn't communicate with you only in the session. So you might get a text check in from me or a scripture from me or something I read that I think pertains to your particular issue, just so that you stay encouraged. And they have that opportunity to text me too with quick things that they're thinking about or struggling with so I can offer up some prayer on my own time.
Do you only work with people in Illinois?
I'm open to all. Being
Just wanted
certified is not state based.
That's good to hear. And then the next question I have is, so I've interviewed quite a different group of Christians throughout the last year. What would be the book of the Bible? If somebody was to go dip their toe into the Bible, where would you suggest for them to start?
That's a very interesting question. The first thing that came to mind was Proverbs because it kind of gives you a way to understand and think through things. So, this is good, this is bad. This is the type of person you should be, this is the type of person you want to avoid. I think, and something that I actually just learned from one of the pastors at my church, he reads a chapter of Proverbs a day because there are 31 chapters of Proverbs. So, if you do one chapter a day, you're really coming into the understanding of exactly who God is and what he desires for your life. I think that's key. Of course, we also have to talk about like sin, salvation, all the things. Proverbs is in the Older Testament, however, the Old Testament, not older, but it gives understanding. In the New Testament, to understand who Jesus is, there are a number of different books I could point individuals to. It just depends on where we are in the walk. And leading them to salvation if necessary.
I appreciate that, and that's actually really refreshing. I know a lot of people point me to John when I first start, and I'm always interesting because I'm trying to build my relationship back up with God.
Mhm,
And I learned the long way is that I won't find God in the church, but I'll find him in the Bible.
mhm. Now, you could find God wherever you are. You can find God in your home. It's just about being aware of your current situation. Uh, all scripture is God breathed. Okay. And being open to whatever that journey entails for you is going to be your personal connection with God. I'm glad that you're reading John. And I think that wherever you are in your life right now, the church is not a building, the church is the body of people.
Hmm.
So, in knowing that, you have to make sure that you're connected with the right people as well to guide you on your journey as you continue to get to know Christ.
Hmm. I like that, and I appreciate that. And I know for quite a few bunch of my viewers, they're veterans themselves. Where would you say to look in the Bible, or actually the the question that I've actually struggled with myself personally? It says, "Thou shalt not murder." For the longest time, I thought it said, "Thou shalt not kill." When people are struggling with their own mental health challenges from coming back from combat,
Mm,
where would you suggest for them to even sit with or be able to look? And I know this is just your perspective, and I would love to hear more about it.
sure. So, for the veteran who sees that commandment in particular, we also have to put things in context and put things into perspective. You went to war for a reason and you're fighting off enemies, right? Simply put, that's also in the Bible. It's a necessary part of the story. Committing murder in terms of being a vet, I don't see that in the same way. Now, committing murder as a civilian, that's how we should look into it. As a vet, you had a job to do. That's what you were trained to do. That's who that's the position that you were put in to protect our country. And we thank you all for serving. That particular commandment is not geared towards that particular line of work. There are things that fall into play with that. And this is my perspective. As a civilian, now you're held to that because you're not doing that for our country. Those individuals are doing that for themselves. So, two totally different things. And know that you, even if you feel guilty about some things, feel shame or doubt, that is not the headspace that God wants you in. You have been redeemed by Him already. You've been forgiven by Him already. So there's some things in your past, even beyond the thou shalt not murder or kill perspective, understanding that we have all sinned. So murder in itself is a sin, let alone lying, gossip, and He views it all the same. So his redemptive spirit has already redeemed us from that as long as we just cast those cares onto him and allow him to get us to our next.
Hey, Doc, I got a question for you. You ever actually thought about reading books out loud to people? Your voice is so soothing over here, man. It's like, yeah, you heard that, haven't you?
And that's very interesting that you say that because I was just on a call yesterday where one of my colleagues said something similar. He's a brother in Christ. He's like, yeah, I don't have the same voice as Harrell. Harrell's voice has a different tone to it. I've heard that before. And I don't believe in coincidence. So I'm going to look into that.
Well, you'll be here trying to make me about to melt. Like, I'm over here just falling. But anyways, I I actually do believe this is that we need to give people more compliments. And
Mm,
when we actually see something, we give them more compliments. And the community that I grew in, we used to crack a lot of jokes. And it's
yeah.
always easy to tear people down for the things that they're not doing right. But
Yes.
building people up for the things, and it seems awkward when you first hear it, but it's always a wonderful thing. So I'm going to jump right into it. What got you into doing this, the Passion Project, the new book, Faith versus Fertility?
So when it comes to this book, Faith versus Fertility, which was released last week on February 17th, This book was something that I felt was necessary to not only document, but give to the world. Because during my journey, or I should say, the journey that my wife and I went on to get our son, it was grueling. It came with so many ups and downs, and it also had some challenging moments that I had with God. And as a Christian, I think it's important to share that your relationship with God isn't always going to be linear. It's not always going to be, yep, everything's going well. Instead, it's going to be, God, I don't know what you're doing. God, what about me? And in sharing those perspectives in this book, I'm also trying to shed light into some areas that, to be honest, didn't exist for me until I went through it myself. So, being a Black man, you never hear, I'm not going to say never, but you very rarely hear about other Black men struggling to have children. And the layer that was added into that for me is I waited until marriage to even have sex. So to feel like I did it God's way and not get God's reward when I wanted it
Mm.
was trying for me. It caused a lot of shame, a lot of discouragement, confusion, anger. I think as men, our first one is anger. We're very comfortable with getting angry, but it's connected to deeper things that I express in this book. I give my journal entries in this book to share my true thoughts and ways in which I was able to navigate this very nuanced process through fertility. It had to be shared.
You brought up something that struck something. It's comfortable for men to go to be angry.
Mhm.
And what about the perspective of, is that taught when we were kids?
So I would just say, I link that a lot of times to societal norms. It's fine for a man to be seen angry. It's not fine for him to cry. And as a man, over and over again, even if we think about, I'm actually referencing my toddler right now. So my toddler, he's 2. Pray for me. Um, and in being 2, he's getting all of the emotions. He continues to develop. He continues to go through his seasons of having to understand boundaries. And yes, sometimes that can change into anger in the way that he may express it, but it's actually linked to something else. You're not getting what you want. You're not getting what you thought you should get out of this. And it's my job as a parent to make sure that I don't ever stifle his tears. I don't ever want to do that to my child because I don't want him to think he's not supposed to cry. I think that's where it starts for men. At some point, you're supposed to be big. You're a big boy, right? Big boys don't cry. There's songs that say that. So if we're saying that from childhood, we carry that into adulthood, but we can be angry.
Well, I wanted to actually just let you know about the chat. Martina Q. Jordan, is that your wife?
Martinique is my wife.
But Martinique, she said, yes, you have a great voice, by the way.
Thank you.
um, so the reason I asked that question is that I've had this conundrum, and quite a bit of the area I want to do research into is how do we actually help out parents and teachers be inquisitive about when boys are angry, what type of emotions are behind it, and teach them emotional regulation so that they can. And my belief on this is that if we teach boys at a young age, less likely for abuse in the home, less likely to go suicide. They're able to use more of the Gestalt way of naming their emotions.
Yes. So those are all the things that my wife and I are working on now. And I'll just take the moment to say, hey, babe. Um, but when it comes down to little boys and emotional regulation, like I said, I never want to tell them to stop crying. I don't say that. But instead, I'll say, you have big emotions and I know it. I understand. I'm here to listen to you. You stay calm as the parent. And in staying calm, and making sure that you keep that calm demeanor and calm environment, that also allows them to calm down. And in that process, you have conversation with them, not a lot, but just talking through like, hey, can you use your words? Tell me what it is that you would like. Tell me what it is you want to say. Now, he may not have the words, like my son is only 2 right now, but as they continue to get older and their vocabulary continues to expand, you continue to encourage them to speak. Use your words. Your voice matters. I really want to help you, but I don't understand what you're saying. I have your emotions. Let's breathe through this together. Let's take some deep breaths. We've adopted that as well in my household, and it's shown great progress. I think if you don't and you just allow it to happen, or you allow it to, like, your tantrums are going to happen. So you do also need to know when to just allow them to have the tantrum and they'll calm down on their own versus let me step in here to see, especially if I don't even know where this came from, getting on their level, having the conversation, treating them like a human being. You're not managing their behavior, they're an entire person. You want to help them grow up to be entire men with emotional intelligence.
It's yeah, it's huge to me. The emotional intelligence to make them I used to use the word phrase feminize it, but it's not, it's humanizing the experience.
Humanize. Yes.
And the reason I say about my own ignorance is because it's okay to be ignorant until you actually realize it's okay to learn a different perspective. And people can change. It doesn't mean that we have to go down the same route every single time. And while you were talking, I was thinking about the marshmallow test. Have you ever heard of that study?
Elaborate because it sounds familiar.
So, marshmallow test, it's there are videos on it, but it was based off of Stanford professors' kids. And the whole thing was if your thing was marshmallows or Skittles, here's a bag of Skittles. When I come back, if you don't eat any of them, I'll give you another bag of Skittles or another bag of marshmallows. The reason that was the book is really profound to me, and I'm wondering if we can also teach that with kids too, instead of actually going to the anger outburst or getting to a sense of pleasure or a sense of relief, being able to sit within that own complexity of emotions, it will be able to benefit them. And what they did was they didn't just only do the control group of Stanford professor kids, they went out to inner city New York, and they did it with teenagers. And when they did that, they realized that the kids that were able to delay their emotions, the gratification of that the problem, the situation, they started having better relationships, higher education, better jobs, and less divorce rates. So I believe in I might be just hearing what I would hear out of your own words, but raising a boy to be a complete human, it's also delaying the gratification of like, "Hey, you had the anger outburst? Outstanding. Great. We're past that." But what was also happening? It's almost like a baby cooing.
Mhm. It You have to realize as a whole person, stifling things isn't necessarily the route we want to go, but we do have to learn disappointment. And if you don't learn disappointment, no's are going to be really hard in life. You'll take no's personal. You'll take no's as attacks, or you'll take no's like God isn't hearing you. That's not the case. And you also have to be okay with no, because sometimes no means you're being protected from something. And if you're learning that as a child, that's going to manifest itself as an adult. So it's our jobs as parents to make sure that we are creating the environments to go through all of the emotions while building up that emotional stability, while or the resilience, or um, allowing people to learn how to self-soothe, process through what this just was, have a better perspective and understanding of why this may have happened. This is not a defining moment. Yes.
And I'm gonna go back to your voice one last time. If you ever decide that should become a radio show host at night, you can start teaching education on there. You'd be putting some people to sleep or actually making them learn, but either way,
Okay.
um, not
Um,
trying to make it I just but I agree with you. I so much agree with you, everything that you're saying. And so I'm going to ask you a really difficult question. And I feel like it's difficult, but when we're so the spaces that are typically therapeutic, most therapy is about 77 to 80%, depending on the year, is female orientated. And the likelihood of them being white compared to any other ethnicity is actually higher, more like as far as the majority of them. Where are some of the places that you would ask a person or suggest a person to look into different cultural competency, messing up that word,
Competencies. Yeah,
competencies,
yes.
and where would you actually suggest for a person to look, and especially in when you're working with a person that has a different marginalized area for years and to be able to connect with them?
So for myself, and I'll say this in general, every counselor should have a counselor. So, and I didn't even venture into the realm of Christian certified counseling until I'd already had my counselor myself. To begin my own journey, I went to, at the time, it was therapyforblackmen.com. Google has everything, and ChatGPT is amazing at this point. So, being able to get specific or having social media sites, podcasts, or websites that are tailored to the person that looks like you or tailored to the provider or healthcare individual that looks like you, that's a good place to start. You can always just go to social media, Instagram. I know that therapy for Black men exists. From there, you can find the individual or individuals that work best for you. I knew that I wanted someone who could potentially relate to me on a cultural level beyond what the typical book learned therapist could bring. If you can't relate to me culturally, that's another layer I have to explain in our meetings as opposed to you just kind of knowing it already.
So it's almost like being suppressed twice by actually having to explain it, and then on top of it, it's just been happening for a while. As a person that's going to be a perpetual student in his whole life, like as a person, I will never understand the background fully. But for a person like myself to go out and explore it, where would it be a place that you would suggest, or what type of literature or movie, podcast? Where would I actually look for so I can become more well-rounded?
So being more culturally aware. So I think experience is the best teacher. I'm going to say that offhand. I can't give you, hey, start with this book, start with this article. I'm not that type of person. I know they exist. The very first step is to make sure that you're putting yourself into spaces with individuals that look different from you. So right now, even in your program, you're learning a different perspective because you're a minority essentially. Having individuals in your life from different cultural backgrounds will also be your biggest tool to becoming more aware of things that exist that you just haven't been exposed to. It's not your fault if that hasn't been your surroundings. Instead, you're making a conscious effort to put yourself in spaces to learn a different way, to see it a different way, and embrace conversations that may be with people that think completely different from you, because those conversations in itself will stretch you to a different place.
I really appreciate your time and even give me some feedback to go learn. Because where I grew up, it was very diverse, and I might, but the more educated that I'm becoming, I realize that just the experiences that we had together were very different based off of each individual. And it's super fascinating to me because it's in the time that we are living in, everything is becoming more hyper aware. And I'm not saying it's woke, it's because it's saying, hey, we're bringing this up to the table because it's just been more of an Anglo-Saxons male dominated world for the longest time. And we're not actually looking at it from everybody. And it's been very interesting on my own journey, and when you reached out to me the other day and we had that brief conversation, I was like, "Fuck yeah, I can't wait to actually talk to this dude. He brings so much of, a different complexity." So I wanted to say thank you for coming on and helping me actually learn a little bit. And what I like to do at this time is, what is, a thing that you want to share with people that are listening for later on? And also What is the message that you want the world to hear?
Absolutely. So, one, referencing my book again, I actually have a copy of it right here. Faith versus Fertility, a Black man's battle between belief and biology. If you are a man or woman going through any sort of fertility trial right now, whether that's IVF or just doubt, discouragement, what have you, this is a book for you. This book is available right now on Amazon and Barnes and Noble. So feel free to peruse that at your leisure. And it's only $15, $10 if you get it on Kindle. It's necessary to know that you're not alone. Biggest reason for even pursuing my PhD in nursing was to become an example. I hadn't seen it. So as I hadn't seen it before, it was difficult pioneering those spaces on my own. Now it's my job as the example to give back. It is my job as the example to put myself out there and share what I've learned in those experiences so that I can encourage people to continue in the path that they're going in or change the path that they're going in. That's why I do the career coaching or even help people to identify what path they would like to start. A lot of times we don't have the information necessary to make educated decisions. And it's my job to help us navigate through what that looks like. I also offer, like I said before, those counseling services. And in doing so, that could just shape your mind for whatever approach you're taking for career, family, uh, expanding your family, all the things is necessary for us to be our best selves. That is my ultimate goal. My job here, my purpose here on earth is to influence individuals into becoming their best selves. So, whether that's improving your Christian walk, improving your career pursuit, helping you become a nurse, because I am a nurse by trade. And as such, I offer NCLEX prep things as well. So whether you've taken your NCLEX or you need to remediate to retake your NCLEX, I offer those services too. It's very important to get the help and be okay getting help. Visit my website, thehjbrand.com, to see all of the things that I just mentioned and peruse to see if there are services that I offer that you could benefit from. Again, that's just thehjbrand.com. Very simple. And you can click around, schedule a free consultation with me to have a conversation, and we can see how we can build you up to becoming that individual that you want to become.
Thank you so much for making that time, and I appreciate it. I'll put all that stuff in the bio when I upload it, and this will probably be about 12 weeks from now. This live will be able to see off of YouTube and then also off of Facebook, my page. So I appreciate your time, Doc.
Thank you so much, Will, for having me. And I appreciate the space just to share. And even it sounds like I encouraged you. So that's my job has been well done.
How do you think it went?